Hey everyone, this is Ben with RegisteredNurseRN.com, and in this video I'm going to talk about nursing specialties. Now in a previous video I talked about the different types of nurses like LPN, RN, CRNA, and so forth. Now in this video I'll talk about the different concentrations or specialties that you can go into as a nurse, and I'll give you a quick overview of it. I will have videos in the future a little bit more into detail and depth on each of these specialties, but this is just kind of a birdshot view of the most common specialties in nursing, and there are a lot, and that is the cool thing about the nursing profession. There are always new specialties, new areas, new technology coming out, and some of these specialties weren't even here a decade or two ago. So I want to tell you a little bit about these, and hopefully that'll help you know what some of the different areas of nursing have to offer you. First, you have neonatal, and of course within neonatal you are dealing with babies up to 28 days old. Now nurses will care for babies longer than that in certain situations, but the term neonatal refers to the first 28 days of life. 4 different areas. You have level 1, 2, 3, and 4. The first level, healthy babies. The other 3 deal with more progressively serious conditions, and they deal with a lot of premature babies and things like that. Next, you have labor and delivery. That's where you actually help the birthing process, and you actually help the doctor deliver the baby. You'll care for the woman as she's in labor and giving birth and monitor her vitals and things like that. Next, you have just a general or bedside nurse, and that's the type of nurse that will just kind of work in an area where you'll have an influx of all kinds of different patients. And even though most hospitals will generally have a floor like that, they tend to kind of focus in one area. So you may have like a progressive step down unit, for example, where you'll get a lot of different patients, but they all tend to be heart patients. So you tend to have a focus even if you are a general or bedside nurse, but there are some nurses out there that just kind of deal with an influx of various patients. Next, you can be a camp nurse. That's where you work at retreats or camps or other similar organizations, and you just provide basic care, treat minor wounds and scrapes and injuries and things like that. Next, you have nurse educator, and nurse educators are usually teachers. They will usually work at universities or maybe educate the public, or maybe even work in a middle school, but they tend to also do research and things like that. So that's what a nurse educator does. Next, you have a dialysis nurse, and these are individuals who specialize in working with the kidneys and providing dialysis to patients in kidney failure and so forth. Next, you have private duty nurses. These are nurses that are typically hired by private individuals to maybe provide specialized care for long-term problems such as diabetes or other types of health care issues. Next, you have the public health nurse, and public health nurses will actually go into the community and educate certain populations of individuals about healthcare practices, maybe or maybe educate them about screenings and when they need to be getting certain tests performed, and also even perform minor screenings sometimes. Next, you have parish nurses, and these individuals usually work in faith-based communities. For example, they may work in a church, and they may provide volunteer work or train volunteer individuals, maybe perform minor health screenings, and educate the faith-based organization on proper healthcare standards and practices. Next, you have legal nurse consultants, and these individuals work as liaisons between lawyers and the legal industry and also private organizations or healthcare industries. And they will often provide consulting work and say, provide, for example, testimony in a court case or something like that, and talk from a nurse's standpoint and say this procedure should not have been performed in this way or something like that. You have perioperative nurses, also called operating room nurses, and of course they assist physicians and surgeons during surgical procedures and provide care for patients during the whole surgery process. Then you have the flight nurse, and those are your daredevils. They go on helicopters, airplanes, and various aeronautical equipment, and they provide in-flight care during evacuations or something like that. And they usually work along with the health care team, such as paramedics and others, and they will help stock supplies and so forth in these flight equipment. Now you have psychiatric nurses, and psychiatric nurses, of course, tend to work in areas like a psych ward. You deal with patients with mental illnesses, and you will distribute medication and so forth. in that type of setting. Next, you have an oncology nurse, and the oncology nurse will work with cancer patients, and they'll administer chemo, educate the patient, and assist doctors and so forth. Next, you have an ER nurse, and of course these nurses deal with patients who are admitted to the ER. And next, you have ambulatory nurse. And this type of nurse deals with the general education and pain management on an outpatient basis. And they will deal with patients and help coordinate their recovery and education so that when they leave, they are able to gain their health again. Next, you have the school nurse. And the school nurse will sometimes teach a health science class. They will also administer medications if some students have special medications they must have at a certain time. They will also keep check with immunizations and things like that. Next, you have the critical care or the ICU nurse. And these individuals deal with critical patients and with very serious illnesses. Next, you have nursing informatics, and that's where you use technology to communicate and manage data and to improve the whole healthcare profession in general, and also provide nursing care and help assist with providing nursing care to individuals. If you like technology, you might like that one. Next, you have pediatric nurse, and of course these individuals work with people up to the age of about 21 years old in most cases, and they'll do things like help with the well child exams. Every time we take our son to our pediatrician, the pediatric nurse there is always really nice and works well with him and giving him his shots and so forth. You have a trauma nurse, and they deal with the blood and guts. They deal with those severe injuries that come in. Next, you have the travel nurse, and these individuals will usually contract with an employment agency that will send them to different locations and different types of settings. And if you like traveling, you want to see the world, you don't want to be tied down, you might be interested in travel nursing. Next, you have the home health nurse, and these individuals provide treatment and care for patients at various ages and work with healthcare agencies a lot of times to go in individuals' homes and provide just basic checkups or care. Next, you have forensic nurse, and these individuals, kind of like the legal nurse consultant, sometimes they will do consulting work, but they will document evidence, they will examine injuries, they will testify whether there was child abuse or whether they feel that there was elderly abuse in a situation. Kind of like your CSI type show, so if you're into that kind of thing, you might like forensic nursing. Next, you have the correctional nurse or the prison nurse, and of course these individuals deal with those prison populations. Those patients can be a little bit more difficult, combative sometimes. They can also be at higher risk for certain diseases, so it can be a little bit of a risky area. And you will, of course, distribute medications and check vitals in that setting. Next, you have cardiac nurse, which deal with the heart. My wife, you would say, is a cardiac nurse. When she first got hired in, she worked in a progressive step-down unit and dealt mostly with the heart. And she does stress tests, and that is, of course, dealing with the heart. Next, you have geriatric nurses, and they deal with the elderly population and helping educate them, care for them, and so forth. If you work in a nursing home, you would say you're a geriatric nurse. Next, you have nurse case managers, and these work with patients to assess and coordinate cost-effective health care. Wound care nurses, that's a relatively newer area where they specifically specialize in treating various wounds like ulcers, bed sores, abscesses, maybe even those crazy skin infections you get with MRSA and so forth. You have clinical nurse leaders, and they work at the micro level to improve care. So they might go in and look at a whole unit and talk with all the health professionals, talk with patients, talk with everyone, and figure out how they can improve care, how they can make things run more efficiently, all within more of a micro level like that individual unit. Next, you have the hospice nurse, and this type of nurse, of course, usually assists patients at the end of life. If you are dying of cancer, for example, you may request to be at your home, and you may want a private duty nurse or a hospice nurse to come in, and they will administer pain medications and just try to make your life as comfortable as possible in your final moments. And then you have nurse managers or shift leaders, and those are the nurses who, of course, take more of an administrative role or a leadership role. They'll work on the floor and usually start out as an RN in one of these specialties, and then they'll rise to a management position, and they'll lead a team and try to organize and provide great care to patients by leading and educating their team and managing all the little things that go on there. So that's a little bit about some of the common nursing specialties. Like I said, there are a lot of them. There's probably more than this because nursing is just a dynamic profession that's always having new areas emerge and new specialties emerge from just a general sort of a pool of healthcare needs. So I hope that you found this video helpful. Thank you so much for watching, and please consider subscribing to our YouTube channel.